Dr. Kevin Kavanagh, he is a retired physician, founder of a national, becoming international organization called Health Watch USA. Good morning, Dr. K.
Good morning, Jack.
All right, so how do you cure hiccups? What's your cure?
Well, I've always been told to hold your breath.
Oh, is that it? That's not very exciting.
I know. I don't have a good hiccup cure, I'm afraid.
Well, you do have some good news this morning about COVID, though. We want that. What do you got?
Well, yes, and COVID is continuing to have rates plummeting. As you know, on Friday morning, we said that a vast majority of Kentucky was in the red. By Friday afternoon, new data was released, and approximately half of the state was in the red. And that's a huge improvement. Unfortunately, Fayette County was still there. And this morning, I would expect another data release, or at least the next day. And I believe that's going to progress. Our rates are plummeting, and that is good news. Now, again, if you're in the red, you should still follow public health advice. It's kind of like jumping out of a plane with a parachute and deciding to take it off 40 feet from the ground may not have a good outcome. So let's wait till the rates get to where the level is such that our public health experts state that we can let up on some of these strategies.
That makes sense. That makes absolute sense to me. If we quit now, it's sort of like leaving in the middle of a war, you know?
Well, and that's true. And you have to realize that when you hear all of the relaxation around the nation, you have to realize that Kentucky, along with West Virginia, are absolutely doing the worst as far as number of cases in the hospital and number of overall coronavirus cases. So we have to hang on for just really a couple more days.
Okay. China abandoning their zero COVID policy because is there a major outbreak in China and Hong Kong?
Well, for China and Hong Kong areas, yes. And this, I think, is pretty distressing because this is a country that had a zero COVID policy. They invested a lot of resources into trying to prevent any infection. And they did quite well during the earlier variants. But when you get into Omicron, what happens is that it's so infectious that it overcomes about any sort of public health strategy you have that's designed to reach zero. You can mitigate the cases and suppress some of the spread in infections, but as far as doing away with it totally, it doesn't look like they've been able to do this. And as you know, China's had some pretty draconian measures as far as public health goes, trying to control this infection. Measures which I don't think ever could be implemented here in the United States. But if you look at Hong Kong, they've had now 34,000 COVID-19 infections with 87 deaths on February 28th alone. And of course, you would expect by this time that to progress. We do not have up-to-date real-time data from that area of the world. And so that's very distressing. In China, they've reported 329 coronavirus cases. Almost half of those are locally transmitted, and that is a huge problem for them because, as you know, with Omicron, it doesn't take many locally transmitted cases to give you a huge outbreak. So I think these countries are going to go through what we went through in the past, and of course their vaccines, I don't believe, are as good because they haven't had previous infections. Omicron may well be a more severe disease than what we've experienced over here in the United States. A lot of its mildness is due to the fact that our population has a great deal of immunity to SARS-CoV-2 already built up. And this type of immunity, I don't think exists in China.
Always good to talk to you. We'll talk to you on Friday. Thank you, Dr. Kevin Kavanagh.
Thank you, Jack.